Veterinarians are expected to know and do a lot and have a grasp of a very wide range of skills, which in my opinion may not be entirely realistic to expect them to accomplish within 4 years. And certainly a veterinary surgeon in their surgical skills will cross multiple species. So a general or mixed practitioner will often be doing surgery on 4, 5, 6 different species. They need to know the anatomy of all of those different species, their different pathophysiology, healing characteristics. You use different instruments, and yet their exposure to hands-on surgical training may be limited to just a few weeks in their final year of their DVM training. And within those final weeks, there may not be that many opportunities for direct mentorship. People that are undertaking specialist training for surgery on humans will undertake first an internship, then a second internship, then a residency, and only after they're into their residency would they actually be considered basically competent to begin to perform surgery. Whereas, of course, in the veterinary world, we leave and are expected to be surgically competent at the end of just our basic DVM training. And while I don't expect that to change anytime soon, I think we can change the way we deliver that training through the DVM program to try and make sure that the skill set that our graduates are equipped with is a little bit closer to what they're expected to have. I certainly was very aware in the early parts of my career of how much I would appreciate face-to-face mentorship, someone delivering and improving my hands-on surgical skills. And so kind of carried that thought forward into my teaching career and really began that process of developing that training from the perspective of how can we teach a hands-on skill, and how can we move a subject which is often traditionally taught through didactic lecture into more of a hands-on apprenticeship type environment. Nothing really replaces having someone stood across from you, adjusting how you're holding instruments, adjusting your body position, adjusting your tissue handling, and it's those skills that translate into patient benefit and patient safety. Esoteric knowledge of adrenal gland vasculature is not helpful if you can't make your way to the adrenal gland in an atraumatic manner.